Up ahead on Legislative Review. Health insurance coverage for IVF. Plus, parking requirements for residential and commercial spaces. You're watching Legislative Review. Thanks for watching Legislative Review. I'm Angela Nolasco. We start off today's coverage with a discussion led by the Senate.
There's nothing more personal than the choice to build a family, and not everyone gets to do that without the help of a little medical intervention, as we say in my house.
On Friday, January 24th, the Senate Health and Long-Term Care Committee held a public hearing on Senate Bill 5121 concerning medical coverage for fertility procedures such as IVF. The bill would require group health plans to cover both diagnosis and treatment for infertility and standard fertility preservation services, such as embryo cryopreservation, egg or sperm freezing, and ovarian tissue preservation, to name a few. Senate Bill 5121 was sponsored by Democratic Senator Noel Frame.
I was not ultimately successful in bringing a second child into my family. But you know what? I came to peace with that because I had the chance to do it without bankrupting my family. Many families need the supportive fertility treatment to have a child. And in the 2 years that I've had the privilege of being the lead sponsor of this legislation, my eyes have really been open to how broad this need is.
Fertility specialist Dr. Lori Marshall testified in favor of the bill, saying Washington is not among the 22 states to mandate fertility coverage, such as Arkansas, California, and Louisiana.
All leading health organizations recognize infertility to be a disease whose treatment is not elective. Insurance should cover it. Using this 2 IVF cycle limit, an independent firm updated the cost per member per month for 7 PEB to be as low as 19 cents. In 2026, you will hear insurance carriers add dollars to this cost of the bill because IVF pregnancies are high risk. They should be subtracting dollars from the cost of this bill because it's designed to essentially eliminate multiple pregnancies. Passing this mandate is clearly the right thing to do now, but I also believe it's fiscally responsible.
In their testimony, Primera Blue Cross said they are, quote, urging caution to the committee over the potential cost of the bill to employers and consumers.
This proposal for us is projected with a 1.4% premium increase, which is a $7.68 per member per month cost impact for the first year. The primary driver of this higher cost is the increased likelihood of high-risk maternity and newborn care associated with fertility services.
The Office of the Insurance Commissioner expressed their concerns about the bill.
We shared with Senator Frame we have some questions about the language of the bill because it says that fertility has to be covered no different than other services, and given all the different things that apply to insurance plans, we would like to work with her on language to clarify that. Thanks.
Thank you for your testimony.
Should the bill pass, these procedures would be covered by group health plans effective January of next year.
This bill really is designed to increase the supply of housing in Washington state, along with the themes that we've been seeing this session on our focus on supply.
On Friday morning, the Senate Housing Committee convened for a public hearing on a bill concerning minimum parking requirements for residential and commercial projects. Senate Bill 5184 would prohibit cities and counties from imposing minimum parking requirements on the following: buildings on the cusp of transitioning to a different purpose, including vacant buildings, residential units under 1,200 square feet, commercial units under 5,000 square feet, affordable housing, and senior housing, housing for people with disabilities, facilities serving alcohol, childcare facilities, and commercial spaces and mixed-use projects. The bill also repeals current minimum residential parking requirements for cities planning under the Growth Management Act, or GMA. Democratic Senator Jessica Bateman is the bill's prime sponsor. She said builders and developers are limited by the current minimum parking requirements, which hold them back from creating or continuing projects to build more housing.
It creates a max that cities can have for residential, and it was half of the space per dwelling unit, but in actual application of that for single-family homes, that would be 1 space per dwelling unit. It would really benefit with something like multifamily, where you have, say, a 60-unit apartment complex. You would only be required to have 30 parking spaces. The parking to provide that is very expensive, depending upon where you are and what type. It can range from $5,000 to $10,000 or thousands, tens of thousands of dollars. It also takes up very valuable space that could otherwise be used to create housing for people. Our minimum parking requirements are outdated and archaic, and they're getting in the way of building the housing that our communities desperately need.
Proponents of the bill say it would offer flexibility for parking needs to meet market needs, especially in high transit areas that don't require a lot of parking. Speaking in favor of the bill, Riley Benj of Washington Realtors said that the state's affordability issues stem from cost and supply.
Reducing parking minimums is an important step to reducing building costs and promoting the development of more housing units, something we desperately need. The bill does not ban parking, nor does it restrict how much parking can be built. Instead, the bill gives building owners the flexibility to determine the right amount of parking for each project.
Opponents of the bill criticized it for not being equitable, saying it fails to consider those who depend on their vehicles for work, especially in areas close to commercial airports. Kemper Development Company opposed the bill, saying parking requirements should not only consider proximity to transit, but also current on-street parking availability, such as in cities like Bellevue, where 80% of commuters drive to work.
The lack of parking has broad impacts on mobility and access in our cities, and so providing parking should be a shared obligation. If adequate parking is not provided with new development, people will look for parking on the street or on someone else's property. We'll see cut-through traffic in downtown neighborhoods, higher levels of traffic congestion due to people circling to find parking spaces, and delivery and service vehicles parking in public right-of-way, blocking traffic and creating unsafe situations.
Speaking with concerns about the bill, City of SeaTac lobbyist Amina Abdallah said SeaTac has unique community needs that are different from those of the rest of the state.
42% of SeaTac is an international airport, which is a major employment hub for city residents. The city has a large number of professional drivers who drive for Uber, Lyft, taxis, limousines, and other shuttles. Their car is their business and livelihood. Parking is essential for these workers.
Abdallah added that SeaTac workers are mostly immigrants and refugees.
These are multi-generational households who rely on multiple members of their household to work and direct their earnings to sustaining their entire family. The jobs these refugees and immigrants hold tend to be hospitality jobs, which come with unpredictable hours and require cars.
Senate Bill 5184 has the support of newly elected Governor Bob Ferguson.
Thank you, Madam Chair, members of the committee. Ben Omdahl, staff to the committee. In front of you is Senate Bill 5148.
During the hearing, the committee also discussed Senate Bill 5148, or the Housing Accountability Act, which aims to, quote, cut the red tape to expedite the construction of housing by first requiring cities to submit their affordable housing plans to the Department of Commerce for approval. If the plans are not approved, the so-called builder's remedy takes effect, a law that would allow developers to build housing projects that don't comply with local zoning laws so that the city may not deny or delay affordable housing projects. Under the proposed legislation, cities may still deny projects that do not meet state and federal law requirements in critical or non-residential zones. The full hearings covered in this episode are available to watch on demand on tvw.org. Thanks for joining us tonight. To watch an entire legislative hearing or floor debate, check out TVW's archives for on-demand viewing at tvw.org.